Hi, my name is Sydney Calhoun. This is my medication administration video for insulin. Here's my badge. And my husband's going to scan the room. Alright, I am in my medication room in my facility. I have the door shut. I am following my facility's no distraction rules. I'm keeping conversations to a minimum. I am not using my phone at all. I don't even have my phone on me. But first thing I'm going to do is perform my 7 rights of medication. The first one is right patient. I have my MAR and my patient care form. So right patient, so Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. MR number is 4176352, MR number is 4176352. Allergies penicillin, right drug, Novolin R regular insulin U100, Novolin R regular insulin U100. Right dose, 10 units, right route, subcutaneously, right time, 30 minutes before meals, I'm gonna put my patient care form away. I'm gonna perform hand hygiene and grab my medicine. Novolin R regular insulin U100, expiration date 12/1/2025, 0800. So Novolin R regular insulin U100, Novolin R regular insulin U100. So I have my right thing. And because this is an insulin injection, subcutaneous insulin injection, I have my 1.5, what are you doing? 1.5 milliliter insulin safety syringe with a 29 gauge and a 1/2 inch needle. And then I am going to alcohol swab my thing, toss it, take my needle, got this, take out 10 units of air, inject my 10 units of air, turn it around, and then alright, I grabbed 10 units of insulin. And then I would have my fellow nurse come and check that I grabbed 10 units of insulin, that I did it correctly, and it's the right medicine and stuff. So now I'm gonna make my label, which has the drug and the dose and the patient's name. And I'm gonna compare it to the MAR, Novolin R regular insulin, U100, 10 units, Jaguar Jones, 8/25/1963, 8/25/1963. Novolin R regular insulin U100, Novolin R regular insulin U100, expiration date 12/1/2025 at 0800. So Novolin R regular insulin U100, Novolin R regular insulin U100, 10 units subcutaneously, 30 minutes before meals. So now I'm ready to go to my patient's room. Knock, knock, knock. Hi, Mr. Jones. My name is Sydney Calhoun. I am here to administer your insulin injection before 30 minutes before you eat. I'm going to perform hand hygiene. The first thing I'm going to do, Mr. Jones, is make sure you are who you say you are. So Jaguar Jones, 8/25/1963, 8/25/1963. MR number is 4176352. MR number is 4176352. Allergies penicillin. Penicillin. Mr. Jones, I see that you're allergic to penicillin. Is there any other allergies that you would like me to know of today? No? Okay. Okay, first I'm going to take your blood sugar levels. Make sure it's not too low. So it looks good. So I'm about to administer your insulin. What I'm going to do is I'm going to raise your bed to a comfortable height. I'm going to expose your abdomen. Go 2 inches away from your belly button and pinch. If I can pinch 2 inches, I'm going to go at a 90-degree angle. If I can only pinch 1 inch, I'm going to go at a 45-degree angle. And then I'm going to keep an eye on you for a little bit and make sure nothing is good. Is that all okay with you? Okay. So I'm going to raise the bed to a comfortable working height. Perform hand hygiene. Get my goggles on, or my gloves on first, which hopefully will go easier than what it normally does, which no, it didn't. And then I'm going to throw these away and get a different pair. My goggles on. All right, I expose the abdomen, and let me do another check before I administer. So Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. MR number is 4176352, 4176352. Penicillin. Novolin R regular insulin U100, Novolin R regular insulin U100, 10 units. Jaguar Jones, 8/25/1963, 8/25/1963. Novolin R regular insulin U100, Novolin R regular insulin U100. Expiration date is 12/1/2025, 0800. Novolin R regular insulin U100, Novolin R regular insulin U100. Expiration 12/1/2025, 0800. All right, we're all good. So now I'm going to take my alcohol pad. Go out. Okay. I'm gonna pinch, let go, slowly inject, wait a couple seconds, pull out, cap, dispose, and then I'm going to take my patient down to a height. First I'm gonna do that. Now I'm gonna make sure my patient's comfortable, and then take them down to all the way down, and I'm going to keep an eye on my patient for a little bit, make sure there's no allergies or any adverse reactions, and I am going to chart the date, the time, and the drug, and how I administered it and how the patient tolerated it. And then I'm gonna come back in 30 minutes to check on my patient. I'm all done.